Well, cancer is the second leading cause of death in the U.S., and it's that cold, hard fact that can make a diagnosis even scarier.
But now some doctors are suggesting that prostate cancer, when diagnosed very early on, should be called something else. Fox 5's Sharon Crowley is live in the newsroom with more. Sharon?
Yeah, that's right, Natasha and Teresa. Cancer, of course, is a word nobody wants to hear and a diagnosis nobody wants to get. Well, now some in the medical community have begun discussing whether to describe very low-risk prostate cancer using a different word, reclassifying it only in cases that are unlikely to spread, with the hope that it might reduce a patient's anxiety and the demand for surgery and aggressive treatments.
As soon as they hear the word cancer, their mind immediately kind of spirals.
Dr. Jane Cho treats prostate cancer. She says many patients panic after getting a cancer diagnosis.
Their mind immediately kind of spirals and thinks, oh my goodness, I have cancer, I need to do some sort of treatment as soon as possible.
She says aggressive treatments for low-risk prostate cancer can be unnecessary. She favors so-called surveillance, or watching it over the course of months or years.
Cancers that are very, very low risk, meaning low risk of it progressing to the point where it spreads outside of the organ of interest. In this case, it's the prostate, and low risk of it affecting your lifespan and even your quality of life. So because of that, the question becomes, does this patient even need treatment at this point?
It's the center of an ongoing discussion in the medical community. Should cancer be called something else in the case of very low-risk cases? A less scary name like pre-malignant might, some doctors say, reduce the amount of unnecessary aggressive treatments that can be risky and have long-lasting side effects.
There's been a lot of discussion, actually, about reclassifying low-grade prostate cancer. And that all comes from the fact that low-grade prostate cancer is basically a type of cancer that is so slow-growing and really never spreads.
Dr. Michael Zalewski is a vice chair in the Department of Radiation Oncology at NYU Langone Perlmutter Cancer Center. He says he's not in favor of changing the cancer classification. He fears patients might forego important follow-up care, putting their health at risk.
There's been discussions about whether it should be called a cancer or not. But in general, the consensus is among experts in the field that cancer, low-grade prostate cancer, is still called a cancer.
Well, you can expect this conversation to continue. It's likely to generate even more debate, especially as medical advancements grow in the field of cancer treatment and research. Natasha and Teresa?
A lot of nuances there.
Sure is.
Sharon, thank you so much. Well,